Have you got a story to share? A moment, an experience, something that happened that you believe that can help someone else? Well, my name's Jay from Journey of a Whitefeather, and I run a show live on Spotify and YouTube called A Chat with Jay. A chat with normal everyday people who have experienced heartache, joy, and love in their life, and they want to share it with you because they believe that their experiences can help someone out there. Become a guest, remove your mask, and tell your story. And always be the best there is, the best there was, and the best there ever will be. Ladies and gentlemen, I have this wonderful, wonderful dentist, as I said, natural dentist, Dr. Rachna. Now, she's got a practice in Victoria, and she does wonderful things with regards to dentistry. Now, the big thing is, she teaches you about proper care. There's proper care that basically, I think it's more like things you don't know. We've been pushed so much upon the media with all this other information. What is the true essence of, I guess, oral and dental health? And there's a lot of things we can do. Dr. Rachna, thank you so much for coming on board. We're going to talk a bit about your background as we talk about the question, because I think we have to get right into this because people want to hear it instead of going on like I am right now. One of your questions you filled in was about the children's health and starting at a young age. We're looking at airway health. Now, can you explain that for me? Airway health. For me as an asthmatic, I'm thinking keeping your airway clean. What about yourself? How do you, and welcome, and let's talk about airway health in children.
Look, it's one of the topic which not many people are aware of, and that, often the first time when the kids, the parents, they bring their kids, they always have got, if they have got crooked teeth, or if they have got crowded teeth, or, sometimes the teeth are not very well aligned. It's all about asking the right questions. So when they're coming to dentists, they're always asking that, how can we straighten their teeth? Or all they're aware of is just braces and Invisalign. But they're not asking question is how did it happen in first place? So if you look at it, when the kids are born, they all have perfect face. Like in the hospitals, when they're born, they all have perfect round face. After that, how they breathe, how they eat, how they sleep is what dictates the shape of your teeth. So your teeth are balanced between your cheek, tongue, and lips. So it's the interplay of your positioning of your tongue. So the airway is so crucial. So if your child is sleeping with your mouth open, 99.9% their teeth will become crooked, because then your lips are open. Because your lips make the front wall of your teeth. So if your lips are open, the teeth will come out. So if somebody's sleeping with the mouth open, and we never, in kids, we look at parents, they say that, okay, they have got snoring issues, or they have got breathing issues, but then they don't focus that much on that. But if we can address how they breathe and how they sleep, we can naturally straighten their teeth. So if you look into our website, or if you look at the cases which we have done, just by addressing the cause, just by correcting their breathing, just by correcting how they sleep, how they swallow, and addressing the tone of your face, facial muscles, we can basically address the root cause.
How the appliance we gave helped him stop his snoring in just...
It was just overnight that my snoring was significantly reduced, and by day 2 it was gone completely. My wife is much happier, as you can imagine. But what I'm finding also is I'm not getting fatigued in the afternoon. I don't wake up with a dry throat, and also I feel when I get out of bed refreshed. I'm not getting out of bed feeling absolutely exhausted as I did prior to using the appliance.
You feel you're waking up less tired, because if you're sleeping well in the night, you've got more oxygen level. So it's the quality of sleep, it's not the quantity of sleep. It's not about sleeping. We do not want to have a disturbed pattern where we're waking up. Imagine if nobody's letting you sleep, that's when we're more cranky during the day. Our concentration towards anything we do gets reduced. And we often find the accidents, people falling off in the cars. It's purely because of the poor quality of sleep they've got in the night. And if we can improve it, and when we're hearing it from somebody else, like normally when the dentist as a health professional, we tell others, people don't believe the validation. They still want to seek validation. So coming from someone who has used it personally, firsthand, somebody who already had been suffering and had been seeking the solution and round of part and used to get tired. The reason being because when you're running, he's breathing from his mouth. Now, after we gave him the exercises, after he started using the appliance and learned the right technique of not to breathe from your chest, instead of breathing from the belly, how your oxygen capacity is increased. And now he says that I can take 10 rounds of carbs and I don't get tired. It's like working smart, not work hard.
I was in the morning, obviously, I was behind the 8 ball before I started, but now it works out really, really well.
Oh, that's so nice. And thank you, Nori. But that's gold for us that, I don't got this.
You look at that, that's magnificent because I'm a natural healer myself. So I look at that, the outcome is great, but you have to look at what caused it. So that's a real, I haven't heard of anything like that. I mean, a dentist talking about breathing is, for me, is unknown. You're the first one. So at what age do parents bring their kids in, or is it like, do they come in at, age 3 or 4, or do they come at 5, or what usually happens? And what brings them in there? So it's basically, okay, my teeth are misaligned, but then you go, hang on, muscles in the face, which makes sense because they're pliable, breathing, and also the big one for me is tongue placement. Can you explain that about a young kid and how you get people to actually come on board with what you're saying?
We need to educate even before the child is born. So like once the child is born, then the first instinct is feeding. So if a mom is not able to feed a child, that itself we know there's a problem, because the natural instinct is we don't have to teach a child how, because the natural instinct is we don't have to teach a child how to breastfeed. It's automatically, it's a natural instinct that they're gonna breastfeed. So whenever a mom is not able to breastfeed a child, then that itself is an indication that there's a problem with the tongue. So that's when we have to look at the tongue types. We look at the lip types, because if there's not proper latch, that's the first sign when we know that the tongue placement is not right.
So we look at those tongue issues. As a dentist, I mean, you obviously think, okay, dentist comes with their, their little drills and all that stuff. I mean, all those. Yes. But we're looking at and you obviously offer that. So can you give us a little bit of an idea? I mean, this is really interesting stuff that we're actually looking at people's mouths. I mean, I look at myself, what's going on. I know my face is deformed in some way. Yes. And what do you do with that? Can you explain to people what the tongue exercises?
Yeah. So there's a small frenum which is attached, which is the tongue is attached to the base of the mandible or base of the bone. So we snip that we release that muscle, and then the tongue is able to move freely. Because as the tongue is able to move freely, it will automatically go to the roof of the mouth. So we swallow 2,000 times a day. So each time we are swallowing, correct swallowing, that's what's shaping your jaw. And as the top jaw grows, it allows the bottom jaw to grow with it, and that allows for the whole jaw and correct. It opens the airway, and so you'll find a healthy child will be able to sleep properly. But if they're having sleeping issues, or if they are crying and if they're restless, that itself, it will give you a sign that there's something not right and something which we need to investigate further. How they're latching, how they're breathing properly, and then they should soundly sleep. But if your tongue is tongue tied, so then it's gonna stay at a lower position. And when it stays low, then if the tongue is not going on top, then the only place it will fall back is at the back, and that it will block the airway. So that stops the oxygen going to the brain, and then the kid starts to grind their teeth. And so anytime when the parents, they come and they say the little Johnny is grinding his teeth, he's not able to sleep. And if a child is not able to sleep the whole day, then he'll become more restless during the night. If he's not able to sleep in the night, then he's more restless during the day. And then sometimes that's where the behavior patterns become different. They become too restless. They're very hyperactive. And then sometimes they take them to GP and, even ADHD, because they cannot pinpoint what the problem is. And then the GPs, they just put them into ADHD spectrum sometimes, and not misdiagnose, but often they confuse it with because the symptoms are so similar.
Cool. So if someone came to you and said that, and that makes total sense to me what you're saying, because I mean, when people actually, the term swallow your tongue, and the tongue actually drops back into it and blocks the airway. That's pretty much what you're saying, and from what I'm understanding. So if that happens at night, I mean, you're not in a calm space. And if you go talk about spiritually as well, when you're actually at a calm space when you're sleeping, it plays upon that.
I think nowadays everything, it's just a habit, like nowadays we are drinking from bottle, we're not chewing as much, we are not all our dietary habits is liquid, so we are not using our jaw muscles, we are not giving that stimulation that's needed for the growth as well. So the I don't have the model with me right now.
That's
why
okay.
I'm a very visual person, but basically the shape of your teeth. So imagine it's like how you're making a pot, how you make the pottery, the pots. So where the shape of the pot is determined by where you're putting the pressure. So if somebody is doing a thumb sucking, like if a person is not able to breastfeed, like if a child is not able to breastfeed, then we give them bottle or we give them tummy. So then you're doing that stimulation effect. So then the teeth will come more forward. The tongue is not going on the roof of the mouth. So then it learns itself, it conditions itself to like swallow without touching the roof of the mouth. And then that habit continues. And then the tongue achieves a more lower position. And then it leads to the tongue thrust or the lisping and everything as well. And that's how the teeth, they all start to mold around it. It's like your waist, how every week the waist is different. So same way, imagine if you have teeth on your waist. So as the waist is changing every day. So if I exercise, then I will have a strong bone. But if I don't exercise, then that part goes into wasting. So same way for the face. So because I'm a trained oral myofunctional therapist, so we teach how we can how just by shaping, how by toning your oral facial musculature. So the three muscle group which forms the shape of your jaw, that's your cheek, tongue and lips. So if they're well toned, and if you're breathing properly, that if somebody is only breathing through the nose, that means they have to keep their lips closed. Because if their lips are open, then they're breathing from the mouth. If they're breathing from the mouth, then the tongue is automatically staying low, and then your face will also change your face, and face will grow into more long face rather than round. So you won't have well developed cheekbones, you won't have wider jaw, because for the tongue you have to have like this. The tongue should be resting flat against the roof of your mouth. If somebody has a tongue tie, then the tongue cannot go everywhere. Even you get problems like sleep apnea. If you got a tongue tie, you will not be able to clean your teeth, the very far back of the teeth, the whole area, because the tongue also have a cleansing mechanism of the teeth. And then you'll have gum issues just because the tongue can't go. And then if the tongue is loose, that's when often people will have sleep apnea, snoring issues. And then if the tongue sitting low, it falls back, and then the brain sends the signal to start grinding, and the patients, they start grinding. Because when you're sleeping in the night, you're sleeping on one side, you're sleeping over there. We're not always sleeping straight and making sure that everything is in perfect position. So
that's look, I can see I could see that you're actually saying it's like any type of training. You're dead right. I mean, if you're not training your muscles particularly, not nourishing them, and not understanding the structure and the movement of each. I mean, we've got muscles in our brain. I'll ask you two questions I've got for you. This was going to be a good Q&A. I think this is the way we're going to run it. I've got two for you. We've got people, right? And I'll say I use it, right? The jaw exercises, you get those little balls that you squeeze on, you do 3 minutes a day. I know it engages the muscle. You put them in your mouth and you chew down, and you just repeatedly chewing down. But what the whole premise is to work the muscles, to work the muscles.
That's right.
Are they good or bad?
Yes, that's very good. So we do say that you have to chew at least minimum. There's also something called myomunchie, just 10 minutes of chewing on something. Because nowadays we're not chewing as much, so we're not using our jaw muscles. So anytime you're chewing, it's a good thing. So anything that's gonna strengthen your cheeks, strengthen by chewing. That's something, yes, we do. Like I will say 8 out of 10 or 10 out of 10. I would definitely say.
Chew. So those things, what they've been showing, I mean, it does work your muscle. It's quite a simple. If you use weights on your arms, you're going to get bigger or whatever. But these ones I use in the morning, just chew down for 3 minutes a day, and you can definitely feel the difference. Have you got a story to share, a moment, an experience? Do you want to remove your mask and write your story to help others around the community, even around the world? My name's Jay from Journey of a Whitefeather, and we have koalas, kangaroos, and Steve Irwin impersonations, and this is a chat with Jay. Remove your mask, write your story. So many people around the world, from normal everyday people to great celebrities like Bruce Buffer and the Kings of Disco, the former members of Village People, come on and talk about their lives. Come on and impart knowledge for you to become a better person. So if you've got a story, you've got experiences that can help anyone, you can email me on whitewarriorhealth@gmail.com or catch me on social media platforms, Journey of a Whitefeather and Words of the Warrior on TikTok. Remove your mask, write your story. And as my hero, Bret the Hitman Hart from Calgary, Alberta, Canada, former WWF and WWE Hall of Famer and champion says, get up in the morning and be the best there is, the best there was, and the best there ever will be. I'd like to take this time to shout out our supporters at Liberty Bullion, the best gold, silver, and platinum traders in Melbourne, even Australia. If you want to give them a call, their knowledge, their customer service is second to none. Back to the show. Number two,
Yes.
I'm going to call it out about bone growth. Now you go to a dentist, and this is the start of it. They tell you about gingivitis or whatever it is, and you talk about bone loss.
Yes.
Now, my belief is, being a therapist, I'm thinking, okay, degeneration of bone is fine and inflammation is fine, but simply inflammation can be changed. Can be changed if you put. I mean, inflammation's heat. You put cold. I mean, it's quite a simple thing. But basically, they say, okay, you've got this for life. La da da da. You're losing bones. Okay, yes, we eat a lot of crap like sugar and all that we all did, and it did affect it. No worries. The red's inflamed. But from what you're telling me, there are some ways we can fix that, or at least stop. Well, I don't know if you can stop it. I'm not. I'll let you go. I'll let you go with.
Yes. So what happens is, like, there is called like regenerate, like, how for face there's regeneration. Same way for the bone. Nowadays we have got lasers which can stimulate. It can allow for the bone to grow. So when we are doing a teeth cleaning or the gingivitis, the way it happens is, imagine if you got splinter on your hand. Until the splinter is taken out, the area becomes red. Same way in the teeth. If we are not cleaning our teeth, your gums will not attach to the tooth. So because the gums will only attach on a cleaner tooth surface. But so sometimes, because we're not flossing or behind the teeth, or sometimes when the teeth are very crowded, it's very difficult to clean in between the areas and you get more buildup. So when there is a tartar that has formed, and if you're not going through like 6 monthly cleans, then the infection from the gums, they penetrate into the bone. It starts to eat away the bone and the bone shrinks down. But nowadays we have got lasers that can stimulate, that can remove the diseased gum, and it can stimulate and it can promote the more bone growth, and it can attach and if you look up to it, there are procedures which are known as LANAP, which is laser assisted new attachment procedure protocols.
And you
as well.
do that
so we
yourself.
have got photona lasers, and that way you can grow the bone back. There are different machines, but now with lasers you can induce. It's like similar to how you can grow your hair back with the face. That it's an anti-aging. With anything you can reverse it.
Oh, see, this is what people want to hear there, because I mean, you go to the dentist, right? And I'm as I said to you, you get your clean, we know the basics, right? But when you walk in there, you've got this for life, you got this for life. They don't tell you about blood pooling, mouth pooling with coconut oil, all those natural remedies, in which you're basically pushing a lot of, but also your knowledge and expertise in your expertise in basically working with the jaw. But it's a quite simple process. Work the muscles and go from there, and stop eating crap, really. Yeah,
you'll find that if you know the science, because we do braces, we do Invisalign, so we understand the mechanics of it. So when we're doing braces, to move a teeth, you're putting 2 grams of force to move a tooth. Now your tongue produces 600 grams. So imagine in like a tug of war, if your tongue is producing 600 grams force, and then you're putting 2 grams of force, your teeth, it's like somebody's doing thumb sucking and you're putting braces on. You're not going to win. You're going to have braces for life, because you have to correct the habit. So we always have to correct the habit. Like, is there a tongue thrust? Like, why are if you look at kids, if they're sleeping with their mouth open in the night, if there is no lip seal, then you will find that the teeth will come out. And like, my own son, like he has this habit of teasing me. He does like every time he teases me. So then the teeth come out. Then I told him and that keep your lips closed, and then the teeth go in. So it's everyday thing. So you have to know how to tone your muscles, how we should sleep, how should breathe. If someone has buck teeth, like
Yes,
if they
yeah.
just do this for 1 month and keep their lips closed, the teeth will go inside naturally without anything.
Okay. Mate, this is amazing. Like seriously, it's so, I think what the big thing is I think we neglect and look, I don't know, all the dentists out there, whatever they're doing, that's their business. But I think having an opinion of, preventative dentistry is what you're doing at the moment. I mean, people have to take responsibility too, and that's the game I'm in. That's changing your mindset, and this is why you and me have got a good mindset of
Yes.
okay. And look, no one's perfect. They obviously they have a habit and they've got to change it, but it takes work to change that habit. And it's one of those things where you will go through, but having great people like yourself will basically get that all happening. You've had a lot of information about young kids at a young age. What are five up to 5 tips you would suggest for good teeth health at a young age? Okay, and we're not talking brush your teeth 3 times a day. What are some of the things that you're not told? 5 things, or a couple of the major things that you're not told. What do you think? Can you give us a rundown there?
The top one is we are not told or we're not taught is how important is your breathing. How important is your nasal breathing? Because if you're breathing from the mouth, why we should not breathe from your mouth? We should only breathe through your nose, because when you're breathing from the mouth, you're drying out the saliva. And if you have got dry saliva, then you'll find that the protective mechanism of saliva, which coats the teeth and which protects the teeth from getting decay, then you will have more decay progression, because you have got dry saliva. So that's when the decay happens. So in kids or in adults as well, if you have got open mouth posture or if you have got breathing issues, then you're more prone to more decay rate. Then that's the one. Secondly, it's like your eating habits. Like sometimes the parents, they give milk bottle, like when they're feeding the kids in the nighttime, sometimes they give them milk, and then the milk stays around the teeth, and milk has got this natural sugar that can decay your teeth.
Yes.
So it's very important that
giving them milk beforehand. Should there be a process? Because obviously, young babies need that nutrients. I mean, I'm no expert, as I said. But what, in your opinion, regarding dental health and obviously prosperity, what's the best time for? What do you advise your clients to do if they come to you?
So there's nothing like no wrong, as long as if you drink any milk and all, you just wipe after drinking your with the milk. You just need to wipe it down with wipe the teeth down with water, or with the gauze or something, so that wipe it down so there's no milk left over. Just have water after that, or just make sure the last drink is water, or you're cleaning your teeth and wiping it down so there's no remnant left.
Is that to do with everyone, Dr. Rachna?
With everyone. With everyone.
Last drink is water. That's a really good one. That's a really good, and it makes sense. I mean, as I said to you, it makes real sense that if you do so, I mean, some people have, and there's a lot of issues out there, but if you have those real basics, idea go, everything okay, look, I might binge eat at night, okay, because I'm going through something. That's fine. But then you go, okay, if I have a habit of going, right, I will have water before I go to bed. Absolutely fantastic.
But it's nothing but making sure the lips are always sealed, or the lip seal. So achieve a lip seal. So that's, if your lips are closed, then you're only making sure that you're breathing through the nose. So the lip seal, breathing through the nose, and tongue on the top. So those are 3 things. So if your tongue is on the top, lips are closed, and you're only breathing through the nose, your teeth will be perfect.
I'll just ask this last question with regards to, because obviously I'm a yoga practitioner myself, and I've done that since I had my back injury. 13 years DDP yoga. There's a plug for you, Dallas. Love you, mate. Breathing exercises, Do you recommend them? Do you what with you when you got clients? Do you recommend to go and see a yoga practitioner,
Yes,
or
it is
what do
very,
you do?
yes, yes, 100%. I always, nowadays it's a lot of like, you'll see asthma, you'll see because noses, like, it filters the air, it humidifies the air. You're taking the premium quality of air when you breathe, like, or oxygen, the good quality of oxygen. We say it's not the quantity. When you're breathing from the mouth, you're taking, more quantity of oxygen, but the quality is more improved when you're breathing only through the nose because only when you're breathing through the nose. So I think in yoga, if you do that yoga pranayama, I think the what do you say that pranayam? Which one is it?
Oh, I do DDP
And yeah,
yoga from America. It's a
it's a different one.
rehabilitational power yoga, yeah, but it
But
does have a lot of
yeah, you
breathing concepts. It's mind,
because
body,
you'll
breathing,
find
yeah.
that because it's also your parasympathetic system gets activated. You'll find that if you breathe through your nose, like right nostril or left nostril, how it's interconnected to the brain as well. So your
Right.
nose clearing practices are very important. So all that happens through yoga. So yoga is so huge. Like if you just do yoga, you can get rid of all the your sinusitis. And I think I'm going to tell you with this latest book I was reading about. I think the author name is like Neston or something. I'll just check it. I was just reading
Yeah,
just
worries.
recently on the end. And he has written down how just by doing how important it is, just your breathing and clearing, how we can, with yoga, we can clear the sinuses.
What's the most important thing for someone in a family situation to do for their health of their teeth, other than the obvious, other than not eat crap, stop eating sugar, la da da, the ones that we always hear.
Yes.
And we've
Yeah.
got the breathing thing. What's another one from you? What would you tell people? What's your number one?
The other thing I see nowadays, a lot of times teenagers, in gym when they're going, they're running or they're doing all the exercises with their mouth open, and
Okay.
they're walking and everything. So that they should not do, and like walking. So they just need to build the lung capacity, the breath hold. Like how ocean divers they have understood that part. But it's all about breath hold. It's all about breath work and difference between chest breathing, diaphragm breathing, and there's so many different breathing techniques. So if they just breathe correctly and be aware of how they're breathing in just in day-to-day activities. And the third one is your posture. Like when we are sleeping or when you're sitting or anyway, or when we're reading nowadays also. But yeah, I think it all basically the main thing, three things are just your lip seal, your head is everything is interconnected. So if somebody has got tongue ties or they're not swallowing correctly, so each time an incorrect swallow, they're doing like they're
Yep.
incorrect swallowing, they're bringing their head forward. So they're putting the 20 pound of weight of the head forward. So that's when they get headaches, migraines, and everything. So everything is all connected. Um, the third thing which you do not know or not many people are aware of it is like your roof of the mouth makes the floor of the nose, so they share the same wall. It's your tongue that shapes your roof. So if your roof of the mouth, if it's not broad, and if the tongue's not on the top, then your nose, the nasal septum gets tilted, and then you
Yep.
will not be able to breathe, and that's when you get deviated nasal septum, because all this is in proportion. So if your top jaw is like, if your tongue's not on the top and this becomes narrow, 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 so then your roof of the, or, the nasal septum gets deviated, and that's when you'll have more problems as well. So it continues, then it becomes like a cycle.